Hi, I'm Dr. Angela Yankee.
And I'm Dr. Kathleen O'Neill-Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
All right, welcome back again for I want to say this is our 15th week of doing these webinars. We're so happy we've had you all join us so far, from Facebook to our own patients. We really appreciate all the support we get from you guys. As usual, our email is firrimupdoctors@gmail.com, and our NFIM hotline is NFIMGMV, as in Gators Make Victory, @gmail.com. If you ever have any questions or concerns or want to become a new patient, you're always welcome to email us at either of those emails or give us a phone call. And now I'm going to bring on your famous doctors, Dr. Angela Yankee and Dr. Kathleen O'Neill-Smith, to teach you about some brain health today.
Oh my goodness. Hi, thank you, Emily.
Hey, Dr. Kathleen will be on shortly. Now, but basically it's
our 25th week for NFIM and 15th week for the FIRRIMup webinar. So thank you all for coming so faithfully. I can't believe we're 6 months into this. Cheryl, can you hear better?
fix my mic.
Okay. So good, thank you. So basically we have been enduring this for 6 months. So thank you all for coming over and over again. Dr. Kathleen will be here shortly. Next slide. So here is how we started. Hi, Dr. Kathleen from Boston.
Hey.
How are you?
I'm very well. How are you all?
Great. How's the weather up there?
It's humid. It's wonderful. It's kind of 70, humid. Yeah, it's great.
Wow, we're
Rainy.
like 90 and humid.
That
Little
sounds
rainy
delicious.
here too.
I don't want this summer to go.
Yeah.
I never want it to go.
We were just saying that it's 25th week with the NFIM crowd and 15th week with our combined webinars. So can you even imagine? We're 6 months
No.
into this. This is how we started. Next slide.
Wow.
Next, and here we are now. A lot of red.
Yeah.
Next slide.
Months.
Let's go through the stats. You know, there's some debate on recounting COVID deaths, or were they comorbid related deaths or deaths. I think that, you know, I listened to Dr. Fauci. He says those were COVID related deaths with people with comorbid problems. So we're just going to present these stats. It's from Johns Hopkins. So there's almost 80,000 total test results confirmed. 80 million. Whew.
Mm-hmm.
6.1 million, 186,000 deaths. It's a lot of people. 2.23 million recovered. In Florida, 4.7 million tests confirmed were 637,000 and 11,650 deaths. So we have surpassed Massachusetts with deaths. We have a senior population. So in Alachua County, 5,345 confirmed, 33 deaths. None of those are ours. We've managed and treated 30 plus COVID patients. 3 got admitted since we started in April. 2 got to the ICU. Nobody needed intubation and nobody has died. Thank you, God. So that's how we're doing. We're faring pretty well here in North Central Florida, Dr. Kathleen. How are you guys doing?
Yeah, I think that's really good, because I think that, you know, it's a 6-month window. Obviously, it didn't come to Florida until later, but still 33 deaths is pretty, you know, every death is a problem, but that's a pretty good number for sure. For sure. In Boston, we're pretty much steady down at a low rate, with maybe in some of the outer suburbs of Boston, which is Boston's very, very diverse. So there's more in Boston, but in the outer suburb, it's less than 4 cases, you know, per 1,000. So it's really reduced, but it probably will see an uptick with the college kids coming back over time. And certainly after this weekend, I imagine we will as well. But we're holding our own. And I think we're extremely mindful and thoughtful about the way we go about things. Boston's definitely a science-based community, so they definitely heed the science for sure in general, not 100%, but in general, for better or worse. But I believe in science as a scientist, as you, Dr. Akey. So there's scientists pretty much believe that the deaths are undercounted, but it is what it is. I think the reality is that this is definitely a disease that is more lethal than the flu. 200, 1 in 200 versus 1 in 1,000 in terms of deaths from the flu, and it's very transmissible. So those are the things that we have to remember. And unless you've experienced it, you may not know it, but it's very real.
And I agree, very transmissible. So there was a request from a patient on telehealth to go over the basics from 6 months ago. So so continue to wear your masks and continue to hand wash for 20 seconds. That's 2 happy birthdays. If you're going to socialize, preferably it should be outside, 6 feet away. And there was a question whether or not to wash your groceries when they come in. So that question was about fomites. I still do. I don't think there's any downside. I wash my hands when the mail comes in. So do you have any other thoughts on the basics, Dr. Kathleen?
Well, the basics have everything to do with, what you just said. So there's nothing magical that we can do at this point. And I think indoors is definitely not being indoors for any major length of time with, depending upon the square footage of the space with many people, including family, I think they're saying now with respect to keeping masks on. So it is really important that we continue with the masks and the physical distancing. And then I think that, let's remember, and what I really want to come back to, and during the month of September and October is, what do we do to protect ourselves? I think that's really, really important. And how do we keep ourselves well? Because we all have a little hole or a big hole, meaning a deficiency or an exposure or something in our system. Nobody is immune from having a problem, a medical predisposition or a medical problem. And the way that you keep yourself healthy is identify where your weak links are or your Achilles heels, and then address them. And we'll be talking more about that in the upcoming weeks.
Yeah, we had just been talking earlier that we're going to somewhat pivot and do our COVID talks probably once a month. We'll do one more next week and then move to just wellness and really how to fortify your castle from our Kick COVID-19 to the Curb book. So yes. Next slide. So here we are in Alachua County. Still, it's about the same. So hospitalizations this week, 28, not too bad. But again, the case fatality rate is still 6 out of 1,000. So we're doing pretty well. We're still managing quite a few on telehealth though. And ours are doing quite well. So any of my patients, if you get sick, let us know right away. Our email hotline is still on. That's NFIMGMV, like Gators Make Victory at gmail.com. And we actually see you every day of the week, especially if we think you're heading into that stage 3 where the lung starts getting involved. We'll see you even on the weekends. Okay. So Dr. Kathleen trained at Mass General Hospital and the Brigham and Women's Hospital. So their main journal is the New England Journal of Medicine. So this picture was published today in the New England Journal of Medicine. So I want to spend some time on it because it's really insightful. So just to orient you, on the left, we have a figure A, we have a respiratory epithelium with cilia. Now see those long hairy things? That's like what cleans up your respiratory system. They act like mops. They literally flow. And if you see it in real time in video, you'll see them flow to clean up junk. Now the junk in this picture actually is a mucus, which looks like a spider web. Yes, good job, Emily. So the mucus it's being cleaned up. Well, it's being attacked by a virus because it's an experimental model. They put virus in there and then 4 days later they blew it up, and that's figure B. So this is incubation, 4 days later. Those little COVID particles, there's many of them. And note that they basically, in order to replicate, the COVID-19 virus called SARS-CoV-2 has to not only overcome the one cell barrier to you, as is in our book, it actually has to hijack your cell system in order to replicate. And this is day 4. So you remember from our grids of how the virus replicates, you start having symptoms. Like, let's say today I inhaled someone's sneeze of COVID-19 virus. By day 4, if you were to biopsy me and my immune system was good, you would see that. And I'd probably start having symptoms, because once the body gets infiltrated, if you remember from our book, you activate the chest set and you release these things called interleukins, chemicals that cause the fevers and the aches and the fatigue and everything else. So this is a in vitro, in a petri dish model of an infection of a respiratory epithelium cell. I love this picture. I think it's really cool. So
One of the things that
virus.
happens, one of the things that happen, we have our hair in our nose, right, as well, and we have, mucus in our throat and things like that, and then we have these lymph nodes in our throat, and all of those are designed to prevent and to be on the ready to prevent the COVID-19 from coming in as well. But once the COVID-19 is, here they've infected with multiple different viruses, but if you have just a little bit of virus that gets in, it basically, regardless of how much it gets in, it will open up one of the, it will get into the cell and kind of, it's like opening up a window in your second or third floor of your house that's unlocked. It gets inside and then it opens all of the cells up around it and allows for more viruses to come in and replicate and then to take over. So it's like, a burglar coming in through one window, but opening up every door and window and just letting all these viruses come in. And over time, as they replicate, then they begin to produce these symptoms. And ACE receptors, as we've talked about, are, abundantly present in the nasopharynx. So that's why that happens.
Yeah, so that is the doorknob of these little viral particles to get in the cell, is the ACE2 receptor.
Mm-hmm.
Perfect. Okay. Next slide. So today we're going to talk about the brain effects of COVID. Next slide. And so you might remember this from that discussion a few weeks ago about the loss of taste and smell. Well, let me just orient you. This is a sagittal view of someone's nasopharynx, okay, and that's the nose. And that pink stuff is actually called the nasopharyngeal cells, right? And that's where the virus can infect. But it only takes one cell layer, the neuroepithelium, to enter into the olfactory nerve. And this is what Johns Hopkins found about a month ago, that the olfactory or cranial nerve 1, olfactory nerve, has 200 to 700 times more concentrated ACE2 receptors. So there's a ton of doorknobs for the virus, which enters through the nasopharynx, to enter into the olfactory nerve. And you can see as the arrow's going up how it could climb up into this cribriform plate, which is that bony part, cross the blood-brain barrier, into the olfactory nerve, into your brain. So you could see how that would work. That's why it's so important to wear a mask. In our population, we also recommend intranasal silver argentin, which is antimicrobial, sticking it up your nose. But you could also see why you would have dysgeusia or loss of smell, because it can actually kill that nerve. And we on the last webinar, when we talked about it, we said about 60% will return their nasal, their ability to smell within a month. But you could also see why it could damage that nerve.
Yeah. So this is the main reason that anosmia and lack of smell and taste are common symptoms in the beginning phases. But that pink stuff as well is the mucosa, and it's rich with blood vessels. And you know how much the nose can bleed. So we also talk about COVID being an endothelial disease or a blood vessel disease. And those, just like you see those little yellow, pruning branches of the olfactory nerve, you've got lots of little red capillaries, obviously, in the nose through that, and that pink mucosa. And there are ACE receptors there as well. And that's where COVID gets into the blood system. So it can go through the nervous system but it can also go through the blood system. And when it goes through the blood system, in the same way that it opens up those doors in the ACE receptors of the olfactory nerve, when it goes through the blood system, it can create leaky blood vessels, leaky blood-brain barrier. So there are multiple mechanisms. It's a multi-system disease, and there are multiple mechanisms for the way that it works, in that the COVID can affect the brain in multiple ways through multiple mechanisms, blood vessels, nerves, right directly through the cribriform plate, any of these. It's pretty interesting. So it is important for us to stay healthy. And
Great points. And I'm glad you brought that up, because in the papers, it said it wasn't clear that when it does attack the brain, if it's through direct transmission, as we just showed you, through the, for example, olfactory nerve, or is it blood getting into the brain?
I think it's
probably both.
Yeah, I think it's both, because the blood-brain barrier is a filter that tries to keep things out and only really allow nutrients in, tries to keep harmful things out like toxins and bugs. And when that blood-brain barrier becomes leaky, which is exactly what happens in the lungs and in other parts of the body, and in the rash and the COVID toes, there's a leaky barrier. When the barriers are leaky, that's when you end up with this storm or this inflammatory kind of sludge or mucus or fluid. It's all of those things that gets out into the periphery and can cause the skin or the symptoms of dizziness or a seizure disorder or delirium or whatever it is, stroke.
Great points. Perfect. Yeah. So let's look through some of the studies. So the first study actually was published in the Journal of the American Medical Association in April of this year. It was a case series from China with 214 patients. The mean age was about 53 years old with COVID infection, and most of them had severe infection. But what they found was that there was a lot of neurological complications from COVID-19. And again, it was first series published in April. So with skeletal muscle injury, meaning the muscles hurt and there was evidence that the muscles were being destroyed, with severe infection, about 20% had skeletal muscle injury versus about 5% with mild infection. So that's a lot. 20 out of 100 people had skeletal muscle injury with severe COVID infection. Impaired consciousness, so that means confusion and delirium, about 15% had impaired consciousness, but if you only had mild infection, it was about 2.4%. But here's the kicker. For acute stroke, cerebral vascular accident, CVA, stroke, 5 out of 214 patients had strokes, of which the youngest was 27 years old. And so that's what we're going to talk about next week, is that this particular virus causes pulmonary embolus or blood clots in the lungs, but it also causes clotting elsewhere, like brain and heart. So the youngest, again, who had a stroke was 27 years old.
Well, remember that a stroke, a heart attack, a pulmonary embolism, those are just all clots in different organs, and that's how we refer to them. And I think that that's an important thing. One of the things that Dr. Icky mentioned on the last slide was that we don't have to go back there, but was that we're learning these mechanisms now of how this virus works. We don't know everything. We're still in the process of learning this, and because it's been hard to collect the data because it's such a multi-system disease, it's really important that we continue to follow up with people who get better, but have continued neurological symptoms or continued cardiac symptoms or continued muscle symptoms, whatever the particular symptoms are. It's really important that we continue to follow so we can see how this particular COVID infection, once somebody is infected with it, mild or severe, how it continues to infect and not infect, but affect our systems. That's really, really important.
That's a great point, because even in our patient population, the 30 we're following into their healing after COVID, many of them have chronic fatigue, or they're still having respiratory problems. I saw a nurse today who's COVID negative, but really her bronchial spasms are bad. She's got respiratory problems now. I've seen another patient who just has brain fog and can't remember things quite as well. So yes, you're talking about like the damage residual after COVID.
Really important.
Next slide. This was this next slide actually was an early case report of catatonia related to COVID. And so the 3 ways that COVID impairs the brain: direct viral infection, either through we showed you, through the nervous system, through the olfactory nerve, for example, or through the blood. And that's called encephalitis, where if the person passed and you did a biopsy of the brain, you would see the virus in the brain, encephalitis.
Mhm.
And that presents as confusion, fever,
Delirium. Yep.
delirium.
Mhm.
And then we told you about acute strokes, blood clots. And the third way is immune system attacking the brain. Again, these are the injuries or the autoimmune. And so Dr. Kathleen and I love to talk about gut on fire, brain on fire. And she was the one that introduced me to Susan Cahalan here from Brain on Fire. It's a movie of a true story of a woman who had autoimmune brain disease. It was called NMDA, encephalitis. And basically they have case reports now of this after COVID-19. And she basically presented catatonic, and they thought she was crazy. So she went to the psychiatry ward. It took a long time, but a really smart doctor figured out she had an autoimmune brain disease, gave her progressive treatments, and she's now normal. And she lived to talk about it and write about it. It took her about a year or two to get better.
Well,
But
they
they're
never
actually
found a
documenting
source
that
in
now.
her, which is interesting. It may have been a viral source, and then it basically, waxed and waned, but mostly it progressed over time. And she was really lucky. This NDMA receptor encephalitis has just been kind of elucidated and delineated because of Susan Cahalan, who was a New York, not a New York Times, but a New York
New York
Magazine
Post,
reporter,
New York
New York
Post.
Post reporter. And she was very young at the time. So it was a really, really interesting story that I find just really fascinating. And fortunately, she had a great doctor who was very humbled and who took the time to really observe what was happening and then to understand. And she went through a surgery. But I think at this point, if we can find this now that we're aware of it, if we can find these things sooner, and we see the symptoms of delirium and confusion and potentially seizures and catatonia, we can then help patients a little bit more readily.
Yeah, and just to clarify, there's a typo there. It's NMDA.
Mhm.
N as in Nancy, M as in Mary, D as in dog, A as in apple. So anyway, it's a great movie. You guys should watch it, but it is reported now as a fallout of COVID-19. And again, this literature is just now unfolding. Next slide. So before I saw
a study.
about a month ago about catatonia, they didn't mention the NMD.
Yeah, so with Catatonia case study, there was no
condition that this case study actually, the person just didn't move. Catatonic meaning you don't move. You had psychomotor retardation and strange behavior. And sometimes you could get misdiagnosed as having a psychiatric disorder when you have a real medical problem. Next slide. This just talks about being aware that if you have had COVID-19, it's possible that you could have presented psychosis afterwards. Next slide. Okay, so let's give you some hope here. First of all, we've tried to teach you really over the course of many weeks how to fortify your immune system so you don't get sick in the first place. And from Dr. Kathleen's in our practice, our patients have done really, really well. So the question is, if you were to be sick and have that brain fog like a couple of our patients after COVID, how do you get better? How do you get better, Dr. Kathleen?
Well, forget even about getting better. Let's prevent. Okay. I mean, I think that, look, people don't see us until, the cat's out of the bag and they're feeling something unwell and then they want to do something. But what we promote is that you look prophylactically in advance instead of going to a doctor and just saying, oh, my cholesterol's up, I'm going to get a cholesterol med. Let's go to doctors and see where the holes are in our roofs, so to speak. If we have a hole, if we know that we have a hole, if we know we're missing omega-3s, if we know that we could benefit from glutathione because our levels are low in our blood, or phosphatidylcholine, then why are we going to wait for a COVID infection to fix it? I think we should fix it in advance and we should measure whenever possible. And we should continue to restore these balances. Omega-3s are essential for multiple reasons. There's stacks and stacks of papers on omega-3 fatty acids and the benefit of the them for brain healing. The glutathione speaks to all the colors in this rainbow and basically, is an antioxidant. And as an antioxidant, glutathione helps to remove the waste products, the gases that are released, the byproducts that are released when there's a storm of some sort. It's like as if the trucks are out and picking up all the trees that have blown down in a hurricane. That's what glutathione will do. And glutathione you can take specifically if you really need it, but you can also get it through food sources. So, any of these vegetables, some of the crucifer vegetables, anything green and blue and red and pink and purple, a variety of colors are really, really important to have multiple times a day on your plate. And then the phosphatidylcholine, again, is a membrane stabilizer because it's part of the cell membrane and will be very protective in terms of not allowing bad things to enter your cell. It's not like zinc, it's a little bit different, but it's really important to have a healthy brain so that you don't end up with any of these scary symptoms if you were to be exposed to any bug, including COVID.
And then if you are trying to recover because you can't smell, those would be my go-to as well. Phosphatidylcholine, I would just add, you can find in eggs. So 1 or 2 eggs a day.
Choline and the yellow of the egg and the yolk of the egg. Yeah. Perfect.
Next slide. So I see the question, so I'm just going to pitch them to us. There was a question earlier about flu vaccine. We keep getting the same question. It's a little early. I think later September and October would be good timing because the flu vaccine works for about 6 months. If you're at high risk, but don't do many vaccines all in a row. You don't want to do more than one for sure. And you want to do it when you're peak healthy and not sick because it does use your immune system to make immunity to a flu vaccine.
And we're hopeful that there'll be less flu. I mean, I know they're saying there's going to be more flu, but if we stay distanced and if we wear masks, we've talked about this before, Dr. Akey, that we're hopeful that there'll be a little less flu. So if you're really not going to be going anywhere, I don't think that you need to rush to get the flu vaccine right now, but do make sure that you are well and in your healthiest state, physical state when you get the vaccine.
I agree. And that was proven from first quarter of this year that the flu was lower than the previous year because people were sheltered in and following all the precautions we had mentioned earlier. Okay, just a couple more. What are your feelings about routine dental cleanings, Dr. Kathleen?
I'm very much for routine dental cleanings. I think it's really important that the gums stay clean. Just like you saw that the cranial nerve that was in the photo and the picture that Dr. Akey identified so well. I mean, you don't want additional bugs, additional food sources to be stuck between the teeth or in cavitations that basically continue to reduce your immune system function or reduce your immunity because you're battling a bunch of other things that are basically in your mouth. So if you have bugs in your mouth, your immune system has to go and do surveillance and try to clean that up. If you have food in your mouth that are feeding bugs, your immune system has to help clean that up. So I think it's really important to get regular cleanings. If you're sick, don't get a cleaning.
Yeah. But if you're certainly I have a high risk patient who's been sheltering in, but now she potentially has an abscess. Well, you have to go see the dentist. But I would recommend you ask for the first morning appointment, wear a mask, use your silver argentin in your nose, use your PRP spray and everything else we talked about, CD and zinc. Great question. I'll answer Bob's question because we'll wrap it up now. Steroids to treat COVID. Bob, that depends on what phase you're in, the more advanced phases. So there's 4 phases to COVID. If you enter into the respiratory phase 3, 4, the studies are showing that it is positive, that you have a better outcome if you use steroids then. Mm-hmm. So that would be an individual kind of decision as to the timing. Okay, that'll wrap it up for today. I thank you guys for coming. There's 45 live here. Thank you for coming week after week. Next week, we're talking about the
and then we're going to pivot to
preventative stuff like fascia and how to be super well. All right, so thank you all for coming. Emily will wrap it up at this point. Thank you, Dr. Kathleen from Boston.
Thank you. Have a safe and wonderful holiday weekend. If you're outdoors, please wear your masks. If you're in, don't go indoors. You're in Florida. I know you've got the AC indoors, but please be careful, be safe, and we'll see you next week.
Yeah, be safe, be well, and God bless you all. Thank you all for coming. Bye-bye.
Bye.
All right. Thank you both for joining us today. We have a few more supplements that are on sale for this week and next week. So I'm going to go through those real quick. I know I'm going to mess up pronouncing this supplement, but phosphatidylcholine, I believe is how you pronounce it. If you're looking into purchasing this, again, if you go to our FIRRIMup Get Healthy store and use the code FIRRIMUP PTCH, that is going to get you 10% off. And again, that's going to help with your mental focus, your brain function, all that kind of stuff. And then from a few weeks ago, we have the curcumin, the glutathione, and the vitamin C. These are, again, all going to be 10% off with the code FIRRIMUP AGELESS, AGELESS, and that is, again, through September 17th. And then finally, we have our omegas. We have the regular omega, and then for vegans, we have a separate algae omega, and the codes are going to be a little bit separate for those. So make sure that you either take a screenshot of this, or you can go back on Facebook and find this video with all the codes. You can always call as well. But for the regular omega, it's going to be FIRRIMup Omega, OMEGA. And then for the algae omega, it's going to be FIRRIMup Algae, ALGAE. And again, any of these discount codes will get you 10% off of the following supplements that we just talked about. And they all run through September 17th right now. And I believe, oh, one more slide. Again, our medical textbook that Dr. Akey helped to write is available on our website, FIRRIMUPDoctors.com. Through the end of this year, you can still get a 20% discount on either the hardback cover or the ebook using the discount code SCI20. And it's going to be the same. So again, if you forget the code or you don't remember it, you can go back on Facebook, and any of our past few videos will have this same code written. If you ever have any questions, you're always welcome to give us a call or an email. And as Dr. Akey said, next week is going to be about COVID and our blood vessels. So we hope to see you all next week. I hope everyone has a great and safe weekend, and have a good one. I did forget one more thing. As always, we have our September special. If you buy our Kick COVID-19 to the Curb, either paperback or ebook, you can get 20% off of vitamin C and zinc. These are great supplements to take for COVID and not for COVID. They're just always great to have in the back of your pocket whenever you need. You can always find our book on FIRRIMUPDoctors.com, and the ebook is always available on Google Play, Amazon Kindle, and Barnes & Noble for $10. As long as you show proof of a receipt, we will go ahead and honor that 20% discount. So again, everyone have a wonderful weekend, and we will see you next week.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMUPDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.